Hello, my name is Suzy Hargreaves. I'm a researcher in public health at the University of Salford. I'm currently working with a wider team on an NIHR-funded evaluation of an alcohol health champion community intervention. This presentation gives a brief overview of part of the evaluation, looking at how newly trained alcohol health champions understand their training and their new role. The Communities in Charge of Alcohol, or CECA programme, is a public health intervention to train up alcohol health champions, or AHCs, from within communities across Greater Manchester. These communities were especially selected due to having higher levels of deprivation and alcohol harm. CECA takes an asset-based community development approach to try and make use of assets that already exist within communities, such as people's values, capacity, skills and knowledge. 123 community members were trained up to become Level 2 Royal Society of Public Health qualified AHCs. Their role was to give brief advice to reduce alcohol harm and to get involved in the alcohol licensing process. The part of the evaluation discussed today focuses on interviews with alcohol health champions within 3 months of their training. It looked to explore motivations, experience of training, enablers or barriers to putting the training into practice, and how AHCs made sense of their role. In-depth, semi-structured interviews were conducted with 5 champions. The interviews were recorded, transcribed and analysed using a framework approach. Analysis of the 5 interviews highlighted a number of overarching themes. The findings presented here give a flavour of the experiences and views of the AHCs. Motivations to become involved in the CECA programme varied between the champions, and most champions had more than one reason for accessing the training. These included the effects of alcohol in family members, a desire for education about alcohol, and champions' own recovery and a feeling of wanting to give something back to their community. Participants highlighted their experiences of training and carrying out the role. They spoke in depth about how they were recruited, their reflections on the training, and the thoughts of cascading that training to others. They also discussed making sense of brief advice about alcohol, thoughts in being involved in the licensing process, and what they bring to the role of AHC. The newly trained AHCs discussed barriers and facilitators to carrying out the role or having conversations about alcohol. So far in their role, there had been anticipated barriers, but none had yet been realised. These included not being able to give enough advice, concerns about facing hostility from members of the public, and broaching sensitive subjects with people they didn't know. Facilitators to the establishment of the CECA programme included physical assets such as libraries and community centres, personal assets such as community-minded individuals, and champions who already had detailed knowledge of their community and alcohol harms. Throughout their interviews, participants shared their views on wider societal influences on drinking, including peer pressure, the role of alcohol in society and culture, and the effects of budget and financial cuts to local facilities and services. Participants showed some nuanced understandings of their wider communities, including the effects of deprivation and poverty on alcohol harms, and how they perceive that drinking alcohol is ingrained within culture and passed on through generations. The snapshot of results described in this presentation will contribute to the understanding of the ways in which asset-based, community-centred research can be used in public health interventions. The views of the individuals at this stage of their role as an alcohol health champion are important to gather the context in which the CECA programme was implemented and the mechanisms needed to be in place to make interventions like this one successful. I would like to say thank you for listening today and to acknowledge the rest of the evaluation team and the participants who took part in the interviews. If you'd like to find out more about the wider CECA programme, please check our protocol paper detailed in the introduction slide and this website below. The website contains more information on the evaluation and includes some impact stories, a blog and some videos. Thank you very much.